Latiya City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
Two questions. So for diabetic people, is beef good, and would drinking water help? And also, does sea salt help to have the sugar absorbed into blood better? That's one question. And for the vaccine doctor, I'm from America, and I have a lot of friends who are nurses and doctors that were forced to take the COVID vax, and they quit their job. And I did a lot of research, and I found that the CDC, the US CDC, this COVID vaccination stuff, they have no backup. In other words, you take the vax and whatever the consequences is on your own. Nobody responsible for any side effects. And I heard that you always say it's recommended, it's not forced to. So I told my parents do not take it, but do you get the same information when you recommended people to take the COVID shots if it's not guaranteed by anyone? Thank you.
Okay, so that's nothing with diabetes. You can get high blood pressure if you take a lot of salt. So salt didn't help anything about diabetes. Beef you can have, but you should avoid fatty part. But yes, diabetes is like a balance. If you have a good control habit, diabetes, you take less medication. If you would like to eat the way you like it, you need more medication. And that's it. It's just like a balance. So, sorry? How about diabetes? Maybe not likely, but you can. We recommend everyone to take 1.5 liters per day for just general well-being, but not for diabetes, for everyone. Oh, that's good, yeah.
Okay, for the COVID vaccine, it's a good question because everyone, I think, concerned about the side effect of the vaccine. And actually, the vaccine create in a very short term because they need to get some vaccination to prevent the pandemic, which is the worldwide. So like now, the number of people who get the vaccinated is very large numbers. So they got a lot of data to get about this side effect or any complication, but no long-term side effect because the vaccine just create just only maybe around 2 years. So like now, the side effect is quite safe for the short term, but for the long term, we do not can guarantee for the longer period. So for the recommendation, I think it's better to get the vaccination because it can prevent the death, prevent the hospitalization, but for the long term, I cannot guarantee even that, yeah.
So I remember my second question, which is, do you do the advanced lipid test for small dense LDL and large buoyant LDL? This is an extension of the regular cholesterol panel
Yes,
test.
we did. Yes, we did.
Okay.
And lately, there is a new research that suggests that a small dense LDL is more a better marker for overall the lipid profile, because we know that the small dense LDL is the most complete LDL, because once we check the total LDL, they have large buoyant LDL and small dense LDL. Yes, we can do that. But they're not still recommended as general, but yes, we can do that.
Okay, and again, any idea how much that would be?
Oh, I'm not quite sure about this price, but it might be expensive, maybe several thousands.
Okay, thank you.
Yeah, thanks for your talk. I was just going to say there seems to be a growing body of evidence of the danger of long-term COVID, long-term effects for people who did get COVID and having serious implications. So there is some evidence of that.
Or at least you have people around the globe to be friends with you when you have side effects, okay?
Hallelujah, brothers and sisters. We don't have any hands in the air. This is opposite from, righteousness tours where everybody says, put your hands in the air. Keep your hands down, okay? All right, so, well, I thought we were really gifted with a stack of interesting information today from both the doctors, and their answers were very forthright. And so we just have a very small token of our great appreciation. We have some certificates to present you for your talk. Big round of applause for the doctors. We need one of you doctors to stay. You have to help us do the lucky draw prize. They don't trust me to draw the prize, I tell you. So look at this, lucky draw prize number 1 and 2. Oh, free vaccines, cool. We have number 2. Number 2, somebody who was even earlier than me today. Oh yes, I remember you getting in before me. Yeah, stay there, we'll remember you. And number 10. Number 10. Hey, good on you, John. Somebody will come to you. Oh, no, a Q&A draw. Limited to 3 units. Effluenza vaccine. All right, here we go. Yeah.
This is a high-dose flu vaccine, okay?
Okay, cool. Number 12. 12. Have we still got... Yeah, good on you. One of our long-term regulars. 32. 3-2. Okay. And last one on this draw, number 30. Number 30. Hey, there you go. Exciting. Is there one more or are we done? We got one more? Oh, okay.
This is a blood work for diabetes.
Oh,
screening,
diabetes
okay.
test. Excellent.
17.
17. 17. Okay, over there, 17.
Oops. 24.
24. Excellent.
And the last one, 20.
20. 20. Okay, cool. Is that it? We done? Big round of applause for all the Bangkok Hospital. Great friends of the club. And if you're like me and you didn't get anything in the lucky draw, losers. I'm part of the group, okay? So.
Okay. So if anyone interested in vaccine package, so we also have this fast track voucher as well. We can written down the packet that you interest, and once when you visit our hospital, you can give this voucher to the medicine unit, and then you will get fast track to the service. Yeah.
Also, the club will have a talk about perhaps organising a morning where they'll come and give Shingrix vaccine to people who want to avoid the pain and agony of shingles. Next week.
พอยการเกียรติวัฒน์ allergist and clinical immunologist. Today I'm going to talk about the importance of vaccination in elderly. Okay, outline of the topic. First of all, I'm going to tell you why the elderly should and actually must be vaccinated. Then I will show you how effective the vaccine is, especially in older people. Next, this is the most asked question: is it safe for the elderly to be vaccinated? And lastly, some recommendation on vaccination. Let's begin with the first topic. Why should the elderly be vaccinated? As we know that prevention is always better than treatment. Vaccine is one of the important preventive methods. Okay, for elderly, vaccine is very necessary. Cells and other components change or sometimes exacerbate through aging process. Once the tissue and organ age, they don't function as well as they used to, leading the elderly to get infected more easily and severely. Also, the previous vaccine in the elderly have gradually lost their effectiveness over time. Hence, the elderly are the most vulnerable age group in the infection, and that means they need to be vaccinated more than any others. As is shown in the statistic, after smallpox and polio vaccine are available, the death rate caused by this disease dropped statistically. This is also true in the measles. Let's look at the effect of the vaccine in decline in death rate. First, of course, vaccine prevents infection, it prevents risks of severe disease and death. And vaccine help reduce transmission of the disease and also build herd immunity and boost immunity of individual. Let's move to the second topic. How effective of the vaccine in the elderly? Unfortunately, the elderly do not respond to the vaccine as well as those in young age group. In other words, the older you become, the less you respond to the vaccine. However, most vaccines are made with the consideration of the consider of older people. Therefore, they are still effective with the elderly. Moreover, vaccines still help boost immunity in older people. And is it safe for elderly to get vaccinated? It is undeniable that immune system in the elderly could easily get inflammation to the vaccine. Also, scientists know and well aware of this fact, and therefore they made the vaccine in a long process of trial before launching the vaccine that prevent the inflammation and also adequate immune response in the elderly. Hence, vaccines are safe and effective among the older people. And this is the last topic, the recommendation of vaccination. First of all, everyone, no matter how old you are, has to follow the vaccine recommendation of your own country or your country of residency. And then, second, additional vaccines are chosen according to the individual medical condition and lifestyle. For example, a senior traveler wants to travel in a tropical country, the certain vaccine will be recommended before traveling according to the visiting country recommendation. If an older person is accidentally lifestyle or are bedridden, they will always have to keep themselves updated with their vaccine status with their medical provider. According to the US CDC, which is Center of Disease Control and Prevention, it is suggested that the elderly must get these following vaccines. First is the COVID-19 vaccine. The second is influenza vaccine. Third is tetanus, diphtheria, pertussis vaccine. The fourth is zoster recombinant vaccine, and the last is pneumococcal vaccine. Let's begin with the first recommendation vaccine. In the past few years, we have been familiar with COVID-19 and its vaccine. COVID-19 vaccine, of course, prevent us from getting infection from COVID-19 or help reduce the severity of COVID-19 infection. According to CDC, the latest COVID-19 vaccine is monovalent based on Omicron XBB 1.5 sublineage of SARS-CoV-2. This vaccine is suitable for both vaccinated and unvaccinated individuals. This new vaccine can be categorized into two types. mRNA vaccine and protein-based vaccine. With mRNA vaccine, which is shown in the navy blue picture and the gray one, an individual needs only one shot, regardless of their history of COVID-19 vaccination. However, with protein-based vaccine, which is shown in a light blue picture, an individual with history of COVID-19 vaccination needs only one shot, while who have never had COVID-19 vaccine will need 2 shots of monovalent. The second recommendation is influenza vaccine. Before the vaccine, influenza used to be as virulent as COVID-19. In 2023, the number of influenza cases has tripled from last year. Influenza vaccine can prevent influenza infection and decrease severity of influenza infection. Influenza vaccine is recommended annually injected in anyone who older than 6 months. But for the senior over 65 years, CDC recommend high-dose influenza vaccine, which contain 4 strains of influenza virus. This is because the elderly do not respond well to a single dose. Their immunity against influenza is not quite effective with a single dose. Once senior citizens are infected by influenza, their symptoms are more serious. Therefore, high-dose influenza vaccine is highly recommended for the elderly by CDC and Infectious Disease Association of Thailand. The high-dose vaccine contains 4 times as many viruses as a single-dose vaccine. The efficacy of high-dose vaccine is 24% higher than any other regular influenza vaccine, leading to decrease in the death rates of influenza and also a drop in hospitalization. However, the side effect of high-dose vaccine is no different from the regular dose. The third recommendation vaccine in elderly is TDAP vaccine, which combines vaccine against tetanus, diphtheria, and pertussis. You can get this vaccine in 1 shot. So let's begin with the symptoms of tetanus. Tetanus or T causes painful stiffness of the muscle. Tetanus can lead to serious health problems, including unable to open the mouth, have trouble swallowing and breathing, or even death. Diphtheria or D can lead to difficult breathing, heart failure, paralysis, or even death. The pertussis or AP, we know it as a whooping cough, can cause uncontrollable virulent cough that make it hard to eat, drink, or even breathe. The vaccine of TDAP varies upon the medical condition and vaccine history of individual. The fourth is zoster vaccine. Zoster or herpes zoster is a viral disease caused by reactivating of varicella zoster virus, which remains dormant until the decline of our immunity or when people is aging. The incidence of zoster infection is increased by the age, especially in older people when older than 50 years. Also, the complication is more serious in the older people group. The severe complication includes severe pain from the nerve. That makes zoster vaccine highly recommended in the elderly or people with immune defect. In Thailand, we have 2 types of zoster vaccine available. The first, which you can see in the blue box, the zoster vaccine live. This is the effective of zoster it have the effective about 30 to 70% after 1 shot. While the second one is recombinant zoster vaccine, which shown in the black box. It is the only vaccine recommended by CDC, approved in people older than 50 years or people with immune deficiency. The efficacy is higher than the first type, and individual is required to have 2 shots. The second shot is 2 to 6 months apart from the first shot. According to a study, the vaccine remained effective after 10 years after the injection. And lastly, is the pneumococcal vaccine, which help prevent lung infection or pneumonia. It can lead to bloodstream infection or even death. In Thailand, we have PCV 13 and PPSV 23. For people over 65 years old, adults with chronic heart disease, chronic lung disease, chronic liver disease, diabetics, smoke, and alcoholism who had no previous pneumococcal vaccine are recommended to get the first shot of PCV 13 and PCV 15 and then a year later get a booster of PPSV 23. With PCV 20, a patient needs only one shot. Unfortunately, we don't have that vaccine yet. However, in Thailand, 3 more types of vaccine are required for those who have no immunity against mumps, measles, rubella, varicella, and hepatitis B virus. Basically, they have never been infected with such disease or never had those vaccines previously. For traveler, additional vaccines are highly recommended. Those are hepatitis A vaccine, pneumococcal vaccine, dengue vaccine, Japanese encephalitis vaccine, yellow fever vaccine, and rabies vaccines. The vaccination is considered upon the destination of traveler, age group, infection risk, and the immunity status of the individual. Okay, thank you for your time and attention.
Obviously, a lot of information in both those talks, right? And don't forget, those talks are put on the PCEC YouTube channel, so you can go and consult. And I'm sure there'll be wonderful pictures of the wonderful PowerPoint presentation. So I actually have a question for Doctor about vaccinations. One of the problems that can be suffered here is shingles, right?
Yes.
And I understand that the Shingrix vaccine is coming eventually, and it's like 93% effective. Do you know when it might be coming, the Shingrix vaccine against shingles? Shingles?
Yes, it is a zoster vaccine.
Oh, zoster is shingles.
Yeah.
See, I learned something today. Yay! The day hasn't been a complete waste. So thank you for that. Yeah. Is that the Shingrix vaccine that you were referring to that's coming?
Yeah.
Shingrix?
We have it.
You have it right
Yeah.
now. What sort of, do you know offhand how much it costs? The Shingrix? So, who here has had shingles, right? Unbelievably painful, I'm told. Who here would be interested in getting a vaccine that stops them going through unbelievable pain with shingles? And you're in danger of it if you've ever had chickenpox in your life, right? So it may be we could even organise a...
Maybe 5,000 accurate, but we can check it right away.
All right,
maybe 5,000. 2
we'll
doses.
try and get information for that, and maybe even organise them to come here and offer Shingrix vaccine here, because it's you don't want to go through shingles. I haven't had it, but I've had a stone in the kidney, and it couldn't be as bad as a stone in the kidney.
I think it's worse.
Have you had both?
No, but
I'll put it this way. Women who've had stones in the kidneys will say things like, I'd rather have 4 children than 1 stone in the kidney. I was dry retching from the pain, and that was up to an hour after they gave me morphine. So, So questions? For either doctor, of course.
I got a question about the diabetes talk. I'm type 2 diabetic, and I'm starting to develop a problem with dry skin on my feet. Can you recommend 1 or 2 brand names of cream that I can use for my feet, which are easily available in Pattaya pharmacies?
So basically, most of the cream, the commercial one, they just put the same ingredients, mostly 10% urea, and then they put on other stuff inside of that. So you can pick any brand you like, but the most common people would prefer a Eucerin or Jergen. You can find it at any supermarket. You don't need any special cream. They just make your skin get moist. And the important thing is you need to apply that at least 2 or 3 times a day, okay? Once you feel it dry, you need to put it on again. Because it's hard to do that in Pattaya because we have rainy season, it's moist all the time. So some people feel uncomfortable to apply the cream. But the important thing is pick up the one you like and use it 3 times a day.
Good morning. This is a question regarding vaccines. Dengue fever, is it now a vaccine available for that in Thailand?
Yeah. Yes, for dengue fever, we have 2 types right now, which is the live vaccine. But the recommendation, we approve in the age of 4 years to 60 years.
So if you're over 60, you're not eligible for the vaccine?
Yes, because...
Is that because it's likely you've already had dengue fever, or... Because
the vaccination, they just available in this group because they just study in this group.
Oh. So they're concentrating on that group, iron out the bugs and then make it available to older people.
Yes,
right.
for older there's no...
I've heard there's a bit of a spike in dengue fever at the moment. Is that right?
Yes,
Yeah. It's a very, very... We had a wonderful talk on dengue fever some years ago, and for those who don't know, there's like 4 types of dengue, and you get bitten the first time and you think, oh, I just got a bad case of the flu, but I don't have a runny nose. The problem is if you get bitten by a mosquito which has a different strain of dengue fever, and then you can get what they call hemorrhagic dengue fever, which is extremely serious. Go to hospital, and you might go into remission for a while. Do not decide to check yourself out of hospital, okay? So, another question over here.
Yes, hello, and first I'd like to thank Bangkok Pattaya Hospital for coming here today. So with regards to diabetes, how about diabetes prevention? We talk about everything else, but obviously exercise is important. Food, why are we now in the last 50, 60 years seeing a lot more diabetes? There's a lot more sugar in foods, processed sugar. But what foods can we avoid, and what foods are good to have to prevent diabetes? Thank you.
So the keyword of diabetic prevention. So once if you have family members, you get some of that chance to get diabetes from your families that you cannot change. What you can change is the way you eat and keep your weight down. Yeah. So let's say if you calculate the BMI, you should keep the BMI less than 25. So most people with height of about 180s, you should weigh less than about 70s or less than 80 kilos. If you can keep your body weight down, that's the most important things to prevent diabetes. In order to do that, you need to do both, doing exercise and eat healthy stuff. So let's say you can eat some people would recommend Mediterranean diet, or you can have any kind of food that less fat, less processed food, because in the processed food they put a lot of sugar inside. We call it fructose syrup. They put a lot of that as a sweetener in the processed food. So avoid any processed food, eat something healthy, low. You might not need to avoid carbs. You can have carbs.
How about with regards to white rice, especially Coney Island? I hear white rice is bad, if not worse than...
Sticky rice is the worst, so you should avoid that, okay? Because sticky rice, if you eat sticky rice, your sugar will peak up within half an hour. It's even worse than the white rice. And the same amount of food, if you get 1 full spoon of the sticky rice, the amount of the carb you get is twice to the white rice because they are more dense. So avoid sticky rice at all costs. And white bread, actually, yes, it tastes good. That's the problem. Everything healthy tastes good, and everything is good for health tastes terrible. So yes, white bread would be. It's acceptable. It depends on how you eat in overall, but in total, The white bread and the brown bread, if you eat the same amount, you get the same amount of carbs. But the difference is the white bread, once you eat it, you get exactly the bolus of the sugar at that time. And maybe 2 hours later, you feel hungry again and you eat something else. But the brown rice or something with high fiber, you just slowly digest that. And it takes longer time and you gradually get a little bit surge of the sugar. And this will make you feel more full and eat less. So they might avoid you to have the snack during the daytime. That might be better.
Question up here.
Thank you. Quick question. Do you have the respiratory syncytial virus vaccine currently? RSV vaccine? No. Do you have any idea when you will get it? Any idea when it will arrive?
Right now, we did not have the RSV vaccine. Yes, and I did not find the recommendation on CDC or anywhere else.
Okay, then the second question is, do you have the 2023-2024 updated COVID vaccine? You do have that now. Wonderful, thank you.
So because the RSV, they are affected most children. In adult, they just we call it another common cold. So they do not make a lot of problem in adult. So that's why we don't have the vaccine in adult for RSV. But in children, maybe, but we have never heard that yet. Not yet.
We have a question up the back from Daryl. You don't have to stand. Oh, good on you, Daryl.
I think someone had just asked it and got an answer, but I didn't hear the answer. I was interrupted. That deals with the COVID booster. It's been a long time since I've had one. Where can you get it, and is it available?
Yes, you can get the booster of COVID vaccine in the hospital.
We have it right now, the Pfizer one, the last generation. So update for the minor strain that recently developed. So you can get it right now at the hospital. Yes.
Thank you. Going on this COVID-19, I had my booster last year. Do I need another one this year because I'll be going abroad to New Zealand in February? Yes?
Yes, if you, yes, it's recommended to get
please,
a
you'll have to
booster.
speak up, I can't hear.
Okay, it's recommended to booster the COVID-19 vaccine to get the update vaccine.
I don't understand, sorry.
So get once a year.
Once a year,
Yes.
that's what I was
Just
after.
like a flu shot. From
Oh.
now on, COVID vaccine and flu shot, once a year, every year,
I see.
until further notice.
Same as flu, yes.
Yeah,
thank
same
you.
as flu. Yes, correct.
Just a little word to the wise. This is an awkward thing to get the microphone to people. I do register when you put your hand up usually, and I'll call again for people to put their hands up. Just as a matter of politeness, do not poke me for my attention, or I am likely not to get the microphone to you at all. It's rude by anybody's standards.
Doctor, immunisation. There's also a lot of elderly people here, and they went through the period of catching all sorts of childhood diseases. You name them. I had diphtheria, meningitis, but also the chicken pox. When chicken pox was around, they had all the kids get together, and so that immunisation is there. And when I went in the Navy, I think I had every vaccination you could think of, like A, B, and smallpox, yellow fever, everything, because you was going abroad. Now, those vaccinations are still okay. I keep them up to date because the job I had before, I had to have them. So I've got, like, I consider a built-in immunisation. What else should I worry about?
Well, I can think of Japanese encephalitis as one thing. Japanese encephalitis, you're unlikely to get in Pattaya, but if you go up to Isan, it becomes an issue. Your chances of getting it are small, but if you get it, you've got like a 40% chance of dying, and if you survive, you've got like a 40% chance of permanent brain damage. I've had the Japanese encephalitis vaccine. So also, if you travel overseas, you've got to think about what might be there in that country. There's a very good travel clinic up in Bangkok, which is called the Travel Clinic, which can advise you on the vaccines you need in other countries. So I know we still have some more questions. It was a great talk. Well, this gentleman, I think, is before you, and you're next.
So I'm fairly aware of type 2 diabetes, and I know about pre-diabetes. Before then, you would get insulin resistance, and I'm aware that there is a test that you can have called the HOMA-IR test. Do you do that at the hospital?
Yes, we can do that, but the HOMA-IR is just like we check the sugar and we check the insulin in your blood at the same time, and we make a calculation. It was designed for the research. So because each study research, they would like to compare the result to the other. So that's why they make just like a central criteria that, the baseline, that everyone will recognize that. So it doesn't have a lot meanings in treatment diabetes, because you will know that, okay, you have insulin resistance, which you will have at some degree because you have diabetes. But you can know that in the future, if you lose weight, the HOMA-IR would have improved, but they don't have a correlation with the treatment that, okay, you have this number, you need this medication, you have this number, you need to change. It's not a work like that. So normally we don't do that as a routine, but yes, you can do it on request.
Okay, how much is the test for that?
We have HOMA-IR, which is insulin resistant. We check the sugar and the insulin at the same time. I can't remember the price, but less than 1,000.
Okay. And my second question was, is it gone? It's gone. It's gone. No, it's gone.
Okay, maybe it'll come back. Anybody else still got a question? Over here.
Two things. One is metformin. There seems to have been a move away from metformin. Has it gone completely out of the picture?
The problem with metformin is it has been using for 50 years. So we have already known all aspects of this medication. It's cheap. It used to be first line, but because the new generation of tablets, they have more superiority in terms of preventing complication, as I mentioned before. They can help to reduce heart attack, help to prevent the stroke. So that's why the lately recommendation would recommend the other newer generation instead of the metformin. But the metformin is still very good medication in terms of controlling sugar, in terms of we have known it for half of decades. So we know everything about that. You don't need to concern about whether you take metformin and it make your kidney worse. It will not. But if you have some kidney problem, we need to reduce the dose of the metformin. But metformin itself, it does not make kidney worse. Okay. And the other concern is if you take it in long term, the metformin will prevent you to get absorbed of B12 vitamin. So that's why once in a while, maybe every 3 to 5 years, your doctor might need to check the B12 if you have been taking metformin for several years. That's the only concern.
All right, thank you. And the other thing is, I did go to see the doctor, and he said to me, you'll need to stop eating anything fatty. I said, what, you mean like pies, chips? He says, no, just stop eating anything fatty.
It's a joke. I've got this lady first. I'll come back to you.